we know from patients' point of views, from carers' point of views, and from the staff working at the front line that when the system is truly integrated, it works to the benefit of everybody. Hello, I'm Nicola Haywood-Alexander. I am the System CIO at Lincolnshire, working across the integrated care system with the NHS, local authority and partner organisations. Instead of trying to explain what it is, explain how it improves things for our citizens as patients and carers by way of an example, a personal example. So I was a carer for my mother for 5 to 6 years while she had Parkinson's, and she had health and care services from the hospital, the specialist nurses that look after people with Parkinson's, her GP, social services, the care providers who would come in and help her at home, third-party organisations such as the Parkinson's organisation who provided physiotherapy classes, the Age Concern who provided support, and also the Red Cross who would bring equipment that she needed. And also the pharmacist as well, because my mum had to ensure that she was taking regular medication, regular in terms of at the right time of the day as well. And I think integrated care meant all those different organisations understanding their role around my mum as I suppose, a super multidisciplinary team, and being able to have their organisations working together in partnership and operating in a way that each knew what each was doing to support mum, and mum would be confident that each would do what each was doing to support her. And from a digital perspective, that we were using technology and data across those services and across those individuals supporting her, to make sure that they were sharing information about where she was in her care pathways, what medication she was now on, if she was having to go into hospital, if she'd had a respiratory condition or an infection and need to go into hospital, managing that admission, then managing a sensible discharge, ensuring that people then in the community knew about the discharge and were ready to receive and provide her with any additional care they'd identified that she needed. And that to me is a truly integrated care system. And I think we can we know from patients' point of views, from carers' point of views, and from the staff working at the front line that when the system is truly integrated, it works to the benefit of everybody. And those wonderful people that work at the front line feel that they can do the best job they can for their patients and for their service users. It's been interesting because in a traditional way, you would say that it has been disruptive. So in Lincolnshire, it was decided because of the impact that COVID was having, they would move to a very light governance arrangement. Planning became equally very light, very responsive to what was immediately now, or what the government was identifying as we moved as our priorities as we moved through the different phases. But interesting with digital is that you could almost say it was disruptive in a positive way. And out of this really difficult times that we've all been through, as individuals, as communities and society, there has been this positive, that those of us who are advocates of digital enablement of the health service, is that it has been a catalyst for change. It has allowed people who perhaps have been very dubious about the benefits of digital enablement of our services to see those benefits, feel and work with those benefits, find ways of resolving the things that they were worried about, because they've had to. And that's both the care providers, the health providers, the clinicians, and the citizens themselves. The way they have responded really positively to what we've had to do, as in the way we've had to respond on all levels nationally to dealing with the pressures on the NHS, keeping ourselves safe, looking at how we can isolate, and how we can still continue to provide high quality services, but in those isolated modes, those remote modes that keep people safer. And even now, as we are finally sort of winning over the situation with this fabulous vaccine program. It's lovely to see how again the NHS is delivering the vaccine program. It shows what the NHS is capable of doing when it comes together and does something like this, as well as the treatments in the earlier phases. And now we're starting to look at how technology can also help with recovery, and how will we be able to use technology to be able to bring down those waiting lists that have built up over time, and the ways in which they will help us to be able to do diagnosis in the communities, monitor, have multidisciplinary teams across organisations, enable us to move quite quickly through those consultations and those waiting lists. Absolutely. And you can see that how technology was starting to become a key enabler in healthcare strategy. The last long-term plan that was pre-COVID had a digital chapter. That was a first. We hadn't had a digital chapter before. And we had the digital work stream was seen less as being a facilitator of IC services, i.e. just ensuring everybody had their desktops and the connectivity, and if they needed a mobile phone. And I think traditionally that's how IT was seen, but I think it's come to its fore in terms of those people having the expertise in what are the technologies, what are the best technologies that we can be using to enable the new models of care that our colleagues are designing. And I'm a big advocate of co-design. So this is actually bringing those digital expertise alongside our clinical leadership, our transformational experts, and working together on how can technology deliver what they are wanting to do? How can it resolve the problems that they have got? And it's a bit like a Formula One team. You've got your drivers, and they are out there driving the cars, winning the races, but the drivers need a really good engineer and a stop team behind them to ensure that the engine is the best engine, it's the best parts you've got working together in the engine, in tip-top condition. Digital data and technology is a work stream in the national ICS programme. So this is us appreciating at a national level how digital data and technology is an integral part of the ICS organisation and services. And so one of the things we will be working on over this next year is how we bring back in an appropriate level of governance, how we create a collaborative set of services and organisation across the partners that enable digital data and technology to be developed at the system level, but also where appropriate at to support that development at the local partner level as well. And this is about us being able to make decisions around, you know, where is this a policy matter that is sits at the system level? Where is this a strategy matter? Where is this a collaborative services opportunity, or even, you know, a shared solution opportunity for the system? I think in terms of the areas of key interest for us, most immediately, population health management, bringing data into a location that's appropriately managed, appropriately shared within ourselves to enable us to better understand the health of our population, and in particular in Lincolnshire, to understand any health inequalities and how we design and deliver services to address the needs of our population and those health inequalities. The second one is this continued establishment of remote care capabilities. This covers remote monitoring, diagnostics, community-based diagnostics, virtual wards that allow us to either prevent unnecessary admissions and treat people at home, support them at home, or to enable earlier discharges or step down discharges into a virtual ward environment, again back in the home, wherever that individual's home may be. And also to enable online consultation in primary care and digital outpatients with acute and secondary and specialist care. The other area is our shared care record. We are well progressed with our integration capabilities here as a system in Lincolnshire with a care portal, which then feeds the shared care record. We still have a couple of areas we need to ensure are fully integrated, and those organisations, you know, have the necessary IG requirements to share their data with the care portal, and we are aiming to have that complete by September to meet the national minimum requirement. And also, as part of that, we are now looking at how we also use that area to create a patient portal where patient services are clinically led and clinically guided. Another area we're really excited about is that we're developing a proof of concept for a citizen atrium, and this is about creating a place that citizens can enter, and they can be guided to different parts of our health and care systems between us, the NHS, the local authority, our third-party providers. They can access advice and support. They can access self-help pathways to support them with the management of their own conditions. They can loan or purchase or follow up prescriptions associated with digital applications and devices, access their socially prescribed services, and treating this like a citizen relationship environment like other industries do. People will be identified as they come into those environments, if they opt to be a member of those environments, and that will allow us to understand who their GP is, and then by coming through the NHS app, they will be automatically signpost to the particular systems that their GP uses in terms of online consultation and total triage mechanisms. So this is around creating that second middleware, but is much more about the place where the citizen is in charge, and the data that the citizen is collecting about themselves belongs to them, and they can then opt how they want to share that data with those colleagues that are providing them with the necessary services. And then finally, I think another focus is one of my colleagues calls it, you know, back to the bare wood. And this is just one thing that has highlighted for us is the value of good quality core infrastructure. So making sure that people have the technology, you know, the laptop, the desktop, the tablet, the mobile phone, that can perform quickly and easily for them. The last thing our clinicians want, if they've only got 10 minutes with a patient, they don't want to be spending that 10 minutes trying to get the technology to work. So it's really important that we have a high baseline standard for all our technology. And also in Lincolnshire, being a rural area, we are challenged when it comes to connectivity. So we are working with national programmes to look at how we can improve our broadband facility across the region into people's homes, and also looking at how we can adopt gigabyte capabilities for our staff to use to ensure that they have good connectivity while they are mobile and while they are visiting people. I think the first thing is just get hold of what's going on. Just gradually get hold of what I'm trying to think what I've been doing. I've been kind of getting, because I came here only less than 6 months ago. So I've been gradually getting hold of what's already happening in the sector, in across the system. Where are we at with those commitments we've made ourselves as a system against any existing digital roadmap? Where are we at with those commitments that have been that we have made to the targets that were laid down in the long-term plan digital chapter? Where is the energy in the system? So where have you got people who are really enthusiastic and wanting to move forward because they're going to be your champions, your advocates? Where have you got caution in the system? And what are the things, really try to understand what are the things that are worrying people, so that you're really doing your own analysis of where the system currently is at, not just in terms of what it has and what it's delivered, but where is it at culturally. And I have to say, I joined the system and had to get immediately involved in the national vaccine program that had just been launched. But that was a great way of me getting to know people, getting to know and getting to see how people worked and ticked, and understand the system as a combination of cultures and a mix of DNA in terms of the different organisations and then the different people within those organisations. I think the next thing is to then make sense of that. I find it really useful to put some sort of a structure and context, because you've then got to start to then take your ideas of where we need to go and how we need to get there, and take it back out to your leaders, your influencers, and the people that are going to be using this technology, and discuss with them the how. This is what we need to be able to achieve. How are we going to be able to achieve it? What's the best way to achieve it? And then finally, what's really important at the moment is that it is actually a massive portfolio. So you are going to have to work with colleagues to look at how you prioritize that portfolio. And if you have a limited resource or a constrained resource, as most systems have, we have a constrained resource in Lincolnshire, in that we have the investment we have been given, and we're dealing with recovering from a significant overspend. We've then got to make some really difficult decisions about the pace at which we can take certain things, and what are going to be our priority pathways, and what are going to be our priority capabilities to develop and build and establish first. So I think putting the citizen at the heart of everything you do, and then remembering that that citizen is not just a patient. They could be a service user, they could be a carer, and they are also our own staff. Our staff working at the front line. So put those people who are at the point of care at the centre of everything you do, and break down your barriers, and be collaborative about everything you do, even to the point of selfless sharing, bring your altruism to the front and work together to do what's best for those people that are at the point of care. I think the second thing is, for me, is around data. And that's remembering that the data doesn't really belong to individual organisations. It actually belongs essentially to the patient, to the citizen. We are at best the custodians of that data. And again, we have to work collaboratively as the custodians of that data to look after it appropriately and to share it and manage it and utilise it appropriately, again, to get the best outcomes for our patients in terms of their health outcomes, their service, their safety, and their experience. And then I think finally is to be able to feel that we are one team together. And again, if I'm going to refer back to the vaccination programme, I've just come off a meeting in which we have been reflecting. It's been another challenging week this week, but we have been reflecting how well we work collaboratively together across the partners as a system. And in fact, that is what COVID has demonstrated. COVID has demonstrated our ability to come together, to be really innovative, to work together, to put any differences behind us, to not knock down any barriers that were there. And if we go back to what I was saying right at the start about, an integrated care system is about creating the ability that all those people that sit around that particular citizen, supporting them with their needs, can do not feel inhibited in any way as to how they can best work together and be highly interoperative. I think that I hope that we do move to an organisation that works like that, and that the way in which the white paper moves forward through its consultation and its legislation does allow us to facilitate those times when MDTs really felt they could work effectively as MDTs across the systems, regardless of who their employer happened to be. And I think I talk a lot to colleagues at the front line, and I was talking to one of the senior citizens at the hospice who was a district nurse previously, and she was saying about that value of being able to work as an MDT, and how as the NHS has grown, as population has grown, as services have grown, as demand has grown, and as we have become more and more complex, that ability to work as an MDT, which was reasonably simple around 40 years ago, is much harder. And if what we can do with ICSs is make that easier for those people who professionally want to work that way, I think that's great. And that's why, at the Bearwood, before we get into the really exciting, innovative stuff using applications and patient atriums and remote capabilities and AI to support diagnostics, underneath that, there is a basic thing I have to achieve for Lincolnshire with my team, which is that wherever somebody providing health and care services, regardless of what organisation they work for, wherever they happen to be delivering that care to that citizen, they can get to the technology and they can get to the data easily and quickly that they need to get to, because that's our role in helping them work as multidisciplinary teams. Being able to make a difference to people. I really I was raised by people who worked in the NHS, so although I'm not a healthcare professional myself, I spent many a time under the under the desk of somebody working on a ward, shall we say, playing with my toys. So it's something I was always aware of. I was always aware of, you know, the value and the importance of caring for people and being there for people. And you know, if Mum had to get up in the middle of the night to go in because she was on call, or you know, we spent Christmas as a family in the hospital because that's what we were doing. I think that was very much part of me. And I think being able to make a difference, for those people providing the care, make a difference for those people receiving the care, and creating the best environment in which they can do that well, I think is really important. So I can see where our challenges are, and I think what I love the most is being able to solve the problem. So that's where the engineer comes out in me, being able to, you know, see where the challenges are, see where the problems are, and solve that problem for the purpose of a positive outcome for someone else.